and welcome to today's episode of NUMHAC's Corner. In NUMHAC's Corner, what we do is discuss issues of mental health concern. On today's episode, we are going to discuss a very interesting and important topic, which is stigmatization in mental health delivery system in Ghana. I would want to begin with today's presentation with a quote, which is, if you want to know the impact and or level of stigma associated with mental illness in any given community, check on their streets. It is not like there are no people living with mental illnesses in the developed part of the world, but they have come to the level where an individual would walk into a psychiatric institution or a mental health institution for assessment by himself voluntarily. So they easily identify and recognize mental illnesses and treat it earlier. Hence, severe forms of mental illnesses are not reached by people suffering from mental illnesses. So you talk of depression, you talk of bipolar disorder, you talk of schizophrenia, you talk of other forms of mental illnesses, eating disorders. They are easily and recognized earlier. And such ones who would merit admission would be admitted. Those who would merit outpatient department visits would also be seen as such. So it wouldn't escalate to the point where the person would not be able to stay at home and would have to hit the street. But in our part of the world, even when people are identified to be putting up certain behaviors or exhibiting signs and symptoms of mental illnesses, and you approach them, they see you as an enemy because they feel you don't wish good for them. Mental health and mental illnesses are issues not much discussed in our part of the world. So it is not so wonderful that when you come into our part, you see a lot of people roaming on our streets with mental illnesses. Today, we are looking at stigmatization in mental health delivery system in Ghana. Stigmatization, or the word stigma, is actually known in Greek as stigmatismos and in Latin notabilis, which is a mark which is burned into an individual or a tattoo made on an individual to easily identify them as criminals or slaves. So when such marks are made on such individuals, people can easily see them and recognize them and dissociate themselves from them because they are criminals, and the slaves would also be easily identified and recognized and would be used for whatever job it is they have to be used for. But in our part of the world, we do not stigmatize criminals alone, neither do we stigmatize slaves alone. We as well stigmatize people living with mental illnesses. And I would want us to quickly have a look briefly at how we are going to define stigmatization. Stigmatization was actually first used, or it was first explored by a sociologist who was from France, so a French sociologist. Emile Durkheim in 1895 was the first person to explore stigmatization as a social phenomenon. Then in the 20th century, Another sociologist, in fact, a very influential one, of course, Erving Goffman, also describes stigma as a phenomenon whereby an individual with an attribute which is deeply discredited by his or her society is rejected as a result of the attribute. So, according to Erving Goffman, who is a sociologist, he's saying that delving down into what we are discussing, an individual or stigma is a phenomenon whereby an individual, in this case with a mental illness, is discredited by his or her society and rejected as a result of the mental illness. That is how Erving Goffman saw stigma or described stigmatization. Now, we have a lot of people roaming on our streets. Not that they don't have anywhere to go, not that they don't have anywhere to sleep, not that they don't have anywhere to stay. But one thing that is a major challenge and a major concern is what we are discussing this afternoon, stigmatization. People are pushed out of their homes simply because when the society gets to know that they are coming out of this home, the stigma would be attached to the entire family and the entire household. And for that matter, they are pushed away from their homes. If this is not stigma, then I don't know what it would be. Today, I would want us to use STOP to recognize mental health stigma. Using STOP, and STOP in this case as an acronym to recognize mental health stigma. Any attitude, any behavior, any action that is being carried out, we should ask ourselves certain questions if we want to actually recognize stigma. And the S in the STOP is nothing but stereotype. So S for stereotype. So you ask yourself this question: does your attitude, does your action, does your behavior stereotype people with mental health conditions? If it does, then of course, you are stigmatizing them. And with stereotype, we are saying that it is where certain things are overly generalized. So we get people who would say that all mentally ill people are dangerous, they are harmful. All people living with mental illness are worthless, they are useless. You can't entrust anything into their hands. They are not productive. When you put up attitudes or behaviors that depicts this, then you are doing nothing but stigmatizing somebody living with mental illness. So that is for the S. The T, you know, STOP is spelled S-T-O-P. S-T-O-P. And we've seen the S as stereotype. That's your attitude stereotype people living with mental illnesses. T is trivialize. That's your attitude, actions, behavior. Trivialize people with mental health conditions and or the condition itself. Do you minimize people living with mental health conditions? Is it that you feel, or do you think that people living with mental illnesses are not as good or as much good as people who are deemed mentally healthy? If your behavior or attitude trivialize people living with mental illnesses, then you are doing nothing but stigmatizing them. Then we move on to the O. O. And the O is offend. So that do your attitudes, your behaviors, your actions offend people with mental health conditions? So in our setting, people living with mental illnesses fall on spiritual homes. And when they find themselves there, they are being put in chains and shackles, all because they are being stereotyped as all people living with mental illnesses are dangerous, they are harmful, they are wicked, they can kill, and a whole lot of things. So any attitude or behavior that offends an individual living with mental illness is a form or by way stigmatizing such individual. So putting them in chains and shackles, assaulting them, beating them up here and there is a way of stigmatizing them. Then the P is patronize. That's your behavior, your attitude, your action. Patronize people with mental health conditions by treating them as if they were not as good as other people. If your behavior patronizes people living with mental health and mental illnesses, then you are treating them as if they were not as good as other people. Then please stop it, because you are by way stigmatizing people living with mental illnesses. So with STOP, this is how we will be able to recognize mental health stigma. So we said the S is stereotype, the T is trivialize, the O is offend, and the P is patronize. So if for the sake of the person's mental health status, being mentally ill, you abuse the person sexually, you physically abuse them, you assault them, and you do all sorts of things to them that you wouldn't have done to the so-called normal people, then you are doing nothing but stigmatizing people living with mental illnesses. As we've been able to see or to know how we are going to recognize mental health stigma, I would want us to have a look quickly at the effect of stigmatization on the individual. And the first one I will talk about is the stigmatized individual has low self-esteem and finds it difficult, in fact, very difficult, associating with others. So once I'm being stigmatized against, I tend to develop a low self-esteem. And when my peers are going, I find it difficult going with them, because in their midst, I feel like they would say things against me. They would make me have that kind of inferiority complex, such that I would find it difficult associating with them. So stigma devalues people. Stigma discredits people, and it, in a way, contributes to people having low self-esteem. Stigmatization as well comes with unemployment. So people living with mental illnesses, you and I know, and you would in as much agree with me, that even when the person is working before the onset of the illness, for the sake of the illness, would be called by his or her managers and sat down and would be given a release letter simply because he or she has been diagnosed of a mental health condition. So it is not strange when people come to you as a mental health professional and they tell you, I wouldn't want people to know about my condition. Why? Because when people get to know about their condition, their attitudes toward them will change. The next one is delayed recovery. In fact, when people are stigmatized, it delays their recovery, because there are even times they themselves will not even go seek for help. So I have this a medical professional who told me, Victor, it's not like we don't want referring people, but the moment you recognize that this person is exhibiting signs of mental illnesses and you suggest referral to either a psychiatrist or a psychologist, the moment you mention P-S-Y, before you add the psychiatrist or the psychologist, there is a problem. The person is unwilling to go. So such ones would go back home and wait till the problem is escalated. So stigmatization delays recovery. And one other form or one other way it delays recovery is that when people living with mental illnesses are identified, even in their own homes, their parents would tend to lock them up in their rooms, would not bring them out for people to know that this is the challenge they are facing. Then the next one we would look at under the effects is lack of social support. And this is why we have a lot of them roaming on our streets. So not too long ago, somebody asked me, Victor, there are a lot of people living with mental illnesses roaming on our streets in Obuasi. What are you doing about it? And I told him, it's you and I that push them there. So if we are willing to take them back home, they will leave the streets. Believe you me, all these people are coming from homes. And when we are willing to take them back home by stopping pointing fingers towards their families and their homes, they will be willing to accept them back. And by so doing, we can get them off the street. Clearing the street to me is not about going around with pickups and vans, burglaring them into the psychiatric institutions. No. When we do that and they come back home, they still remain on the streets. But I think it's about time we make their families aware that they would have to take them back home and we render services to them in their homes. And by so doing, we can help them maintained in their homes. So these are but some of the effects of mental health stigma on the people that are being stigmatized. I would want us to look at how to deal with stigma as a people. How to deal with stigma. And I came across 9 ways that we can use to deal with stigma. The very first one is talking openly about mental health. And for that one, I do thank God so much for the kind of dedicated staff we've had. I mean, mental health professionals we've had in our settings today, where everybody is doing something in his or her small way to create awareness about mental health and mental illnesses. So when we talk openly about mental health, people tend to understand it better and they'll be willing to destigmatize people that they are stigmatizing. The second thing we would need to do is to educate yourself, you watching me, you listening to me, you hearing my voice this time, to educate yourself and others about mental health and mental illnesses. If you think knowledge is expensive, try ignorance. This was said by a great philosopher. So acquiring knowledge is a way of dealing with stigma, because when I tend to understand your problem, I tend to appreciate what you are going through and I tend to feel the way you feel. So educate yourself and others about mental health. Then the next thing we need to do to deal with stigma is to be conscious of your language. Mind your utterances. Mind some of the things that you say regarding mental health and mental illnesses. I always do say that mental illness is no respecter of persons. So as you tag and brand people living with mental illnesses today, when you are faced with it tomorrow and you are branded that same way, how would you feel? So be mindful of what you say and what you do about people living with mental illnesses. Then the next one is encourage equality in how people perceive physical illness and mental illnesses. I have been saying that to me, mental illness is no different from physical illness because in either of them, there is an abnormality. If I get malaria and I'm unable to go to work, I'm being abnormal. If I'm diagnosed of hypertension, diabetes, it's no different from being diagnosed of bipolar disorder or being diagnosed of depression or being diagnosed of schizophrenia. It's no different. We are all suffering from a disease condition. So please, we should come to the realization that there is no difference between physical illness and mental illness. You show empathy and compassion for those living with a mental health condition. So if you want to deal with stigma, we should be willing to show empathy and compassion for people living with a mental health condition. Place yourself in their shoes. If you were that same person roaming on the street under the mercies of the weather, how would you feel? If you were that same person eating from the gutters, how would you feel? If you were that same person who is being assaulted by people because they don't understand what you're going through, how would you feel? Place yourself in people's shoes and change your attitude towards them. Then let us stop the criminalization of those who live with mental illnesses. It's about time we stop criminalizing them. They are not criminals. If I am not a criminal for being diagnosed of typhoid fever, why should I be criminalized for being diagnosed of schizophrenia? If I am not criminalized for being diagnosed of hypertension, why should I be criminalized for being diagnosed of schizophrenia, of bipolar disorder, of depression, of mania? Why should I be criminalized for this? Mental illness is not a criminal offense. It is a disease condition that needs to be attended to. Then let us push back against the way people who live with mental illness are portrayed in the media. So you come across news headlines like "Madman storms," "Madman kills." Oh, Charlie. I think it's time we push back against these media headlines. Then see the person, not the illness. Why would my name change from Victor Kweku Nuyama to a madman, to a crazy man, to a schizophrenic patient, to a bipolar disorder patient, to a depressed patient, simply because I have been diagnosed of these conditions? Don't forget, before the onset of my condition, I had an identity. So the condition shouldn't overtake my identity. I am the one suffering from schizophrenia. I am the one suffering from bipolar disorder. And the bipolar does not make me. So see me and not my illness. So in as much as we are able to accommodate people living with physical illnesses, we should be able to accommodate people living with mental illnesses, simply because they are not as harmful as we think. What makes them sometimes harmful is that the way we behave towards them, our attitude towards them, tend to make them feel like we are much more offensive to them. And it is said that the best way to defend is to attack. So by way of defending themselves, they end up attacking us, and we say they are being harmful and all that. Then finally, in dealing with stigmatization, or the best way to deal with stigma, the very last one is to advocate for mental health reforms. Advocating for mental health reforms. I know very well in Ghana that currently the mental health bill has been passed long time. That was in 2012, about 7 years ago. The very last bill that President John Evans Fifi Atanos of blessed memory passed before he joined his maker in 2012. But till date, the LI, the legislative instrument that will give that act the full backing, has not yet been passed. So if we actually want to deal with stigma, then we need to all rise to our feet and advocate for mental health reforms. And by so doing, we will be able to buttress or combat stigma, and we all would have a very peaceful community to live in. Same way as I started with a quote, I would want to end today's presentation with a quote. And with that, I'm saying that for me, to be diagnosed of a mental illness is not my problem at all. What will be problematic for me is how society will treat me afterwards. To be diagnosed of mental illness, for me, is not a problem. But what is problematic for me is how society would treat me after I'm being diagnosed of mental illness. To this end, I would want us to draw down the curtains for today's presentation, and we are looking forward to coming your way with another topic for discussion. Thank you so much for making time with us, and do have a great day. It's our prayer and wish that together we all can make mental health system better than it is now. Thank you, and God bless. So we come your way again. This has been your humble servant, Victor Kweku Miano, a psychiatric nurse with the Obuasi Government Hospital and the president of Nukwavic Mental Health Awareness Creation. That's NUMHAC. Thank you so much for your time.